Welcome everyone again to the Mobilizing Your Community from part of the AIDS2012 webinar, Brown Bag webinar series. For today's webinar, we'll be focusing on conference hubs and how we can mobilize our communities to attend the conference and to host a conference hub. Again, my name is Francisco Ruiz. I'm with the National Alliance of State and Territorial AIDS Directors, as well as I work I serve as a co-chair for the National Latino AIDS Action Network. Today with us we have Megan Warren, who is the conference organizer, conference hub coordinator for the International AIDS Conference, also known as AIDS2012. Following her presentation, we'll speak to you a little bit an opportunity around the Community Abstract Mentoring Program, which has been extended to February 12th. So I wanted to speak to folks about that, and then we'll have some Q&A session and have some other activities that are coming up around the Brown Bag webinar series. And so now, focusing on the topic of our webinar, organizing a conference hub. Let me introduce Megan Warren. She is currently the Hub's coordinator for AIDS2012 and is working to expand the reach of the International AIDS Conference and to make sure that all relevant stakeholders can participate. Previously, she's worked in Geneva, Switzerland on the scholarship program for the conference. She comes to AIDS2012 with over 10 years of experience in marketing, business development, and project management in the private sector. Megan?
Hi, can everybody hear me?
Yes.
Oh, great. I'm Megan Warren. I am currently the Hub's coordinator for AIDS2012. So today I'm going to walk you through kind of the who, what, when, where, how of a hub and what the program is, and then we're going to go over some things to consider when putting on a hub, and then we'll end with some specific examples, and they are hypothetical, but we came up with some specific examples that a couple of community-based organizations put on that might spark some ideas for you. Okay, so we'll start with what is a conference hub. So a conference hub is a mini-conference held in conjunction with the international conference. It can be held it can be held during or after the international conference. Basically, we film selected sessions and put them online, and then you can download them and watch them, view them at your discretion. We ask that you follow these presentations with moderated discussions that will allow you to tailor the sessions to your region and what's relevant for you. So why would you organize a conference hub? Well, a lot of people can't attend for many reasons: financial, time constraints, immigration constraints. Some places have travel bans in place. We basically put the Hubs program together to ensure that everybody is part of the discussion and to disseminate the education from the conference to community organizations. Again, you can organize a conference hub at the same time or after the international conference, so anytime from the 23rd of July on. It will be open and active, and you can download the sessions all the way through the end of the year. So, in other words, you could put on a hub if you cannot attend the conference, and use the excitement and the momentum that is generated from the conference to host a hub during the actual event. Or you can use it as a report back to the community. So if you're able to attend the conference, you can actually take the education back to your target audience after you attend the International AIDS Conference. Again, you could use it as a follow-up meeting. So you could just use it to discuss best ways and practical steps for implementing the critical issues that come out of the conference. So we'll move on to who can organize a conference hub. Basically, anybody can organize a conference hub. Community-based organizations, clinics, hospitals, even individuals can organize a conference hub. You just have to be motivated. So how would you organize a conference hub? Well, we ask that you secure a venue, that you have at least 20 participants, and that you have some experts that can moderate or facilitate, basically explain the information to the community. We ask that you show at least 2 conference sessions, The conference will be available in Spanish and English. The sessions that we're going to film, we will translate into Spanish. But if you need another language, we would ask that you do that translation yourself. And then we hope that you will help us with monitoring and evaluation so that we can improve the program for the next year. So that's what we ask you to do. What we provide to you is a pre-planning guide that will walk you through every stage of the process. That is available currently online in our AIDS2012 website. So that's www.AIDS2012.org. We are preparing an IT help desk that you can call in case the session is not downloading. They can walk you through some of the possible problems and hopefully get that up and running. We will provide you with assistance for monitoring and evaluation. So we, do the survey forms and things like that, and we just ask that you turn them in and fill them out online. And then, again, we give you access to the recorded sessions, and that is free, and it will be in both Spanish or English. Another thing that we are providing this year is a hub in a box, which we look at as a do-it-yourself toolkit with everything with instructions and templates on everything from marketing and outreach to fundraising to evaluation and monitoring. So, for example, in marketing and outreach, you'd have a basic press release, a basic information sheet on the 2012 conference, various logos you can use. We put together a letter or a template inviting experts and facilitators where you can just insert your logo and a paragraph about your organization. Basically, we're trying to make this as easy for you to do as possible. So for fundraising, for example, we have a donor letter template requesting money, explaining what the conference is about, and you would just add a paragraph on your specific hub. But hopefully that will make it easy for you to just be able to put the event on. So people need to know which sessions will be available. Well, we are going to try and capture and upload most all of the conference sessions. That will depend right now on cost and how well the conference is funded. Those recorded sessions will be available with a delay of 5 to 6 hours. So if, for example, a session occurs at 9 a.m. and we film it, then it will be available 6 hours max later. So when planning your hub, you need to keep that in mind. We realize that it's kind of difficult to plan a program when you're not going to have access to the actual list of sessions that you can choose from until mid-June. So what we've done, and it's online currently, is put together a spreadsheet of all the sessions that were filmed from the 2010 conference. Now, these sessions will not be available for viewing, but what it's designed to do is help you sort through the spreadsheet from 2010 and look at the topics and the key affected populations that were addressed in that conference and come up with kind of an overarching theme and maybe kind of where you would want to go. Because we realize that a lot of the topics and themes are repeated from year to year. So the exact sessions will be different, but you could still put together a theme of stigma or PMTCT and kind of decide who you're going to invite and start inviting speakers and things. So it's designed to help you plan. And that is currently available on the Conference Hub's web page at the AIDS2012 website. Again, the languages of the conference are English and Spanish, and you are welcome to translate it as needed for your target audience. We are hoping that the Hubs program is a very cost-efficient way to disseminate the science and the solutions that come out of the International AIDS Conference. And so basically the sessions are free. We have paid to film them all and offer them to you, and we're hoping that for those of you who already have a computer, a projector, a screen, that it really will be a minimal cost to put this on, if any cost. For those of you who are smaller organizations who are still interested in doing this, you might look at strategically partnering with a university, for example, that might already have a venue available that they could loan you. I'd like to point out that the Hub in a Box does have a fundraising component, so there is a donor letter. There are tips for who to approach and how to approach them. So that might be useful if you don't already have all the pieces in place to put this on. So now we'll move to some things to consider. When you're creating your conference program, obviously it should address HIV and AIDS, co-infections, or related issues, but your program can either be population-specific, so it can be focused on MSM or women or Latin Americans, or it can be issue-specific. It can focus on PMTCD or harm reduction. And again, that list of sessions from 2010 should help you sort of pre-plan for what will be available for 2012. It is sortable. The spreadsheet from 2010 is sortable by key affected population, by region, by theme and topic. So you should be able to tailor a session or a theme for your target audience. When you're thinking about hub timing and selecting a time and date, be sure to consult the calendar. It seems kind of basic, but we've already received a bunch of applications that occur on major holidays, so you might want to think about that, or other competing events that might be occurring at the same time. We put a list of possibilities there that might be interesting or might generate more interest in your event if you were to host them on those days. Another thing to think about is if you hold the hub after the actual conference, the International AIDS Conference, it gives you a longer time to prepare and tailor the sessions to meet the needs of your target audience, and it also gives you a longer time if you need to translate anything. Some things to consider for session breakdown. Your hub can be designed around any combination of a plenary session, a symposium, or a bridging session. We ask that you show 2 sessions, but that's it. And you could take, for example, a plenary session, which often features 4 speakers. And if you're only interested in 1 speaker, you can watch that 1 speaker and then cut off the broadcast and then, follow that with a moderated discussion that really tailors that to your target audience in your region. Because we understand that sometimes what's of interest in Thailand is not interesting for the epidemic here. So again, you can think about that. So moving on to things to consider, partnerships. Again, if they have complementary services or facilities, in-kind donations could really help you put on your event very cost efficiently. Again, partnerships will strengthen the local response. They offer new opportunities for networking, and again, if you put on a good hub, you really cement the reputation of your department or your organization. So, since this webinar is on mobilization, I thought we would address how you mobilize your community to attend the hub, and then follow that with how will the hub mobilize the local response. So if you want to increase attendance at your hub, we have a web banner that's available I can send out, and it's currently posted on our website that you're welcome to download. You can do an email campaign with push mails. Again, there's social media. Marketing at local events. So if partner organizations are having conferences or receptions, things like that, we will also so if your partner organizations are having conferences or receptions, you can attend those events and, market both through announcements and or through flyers. We will also be promoting any hub that's applied and approved. We will be promoting all of those on the AIDS2012 website, also our AIDS2012 Facebook page and Twitter page. Again, one way to increase attendance at your hub might be strategic partnerships, because you have your target audience, but if you pair with someone new, you're opening up a whole new set of people to invite. And websites of affiliated organizations are a good place to advertise it. So then how does the hub mobilize the local response? You can really strengthen the local response because the sessions that are offered or that are coming out of the International AIDS Conference are really the latest science. They're the latest developments in the industry, and they will help you increase the knowledge and skills available in the community. It can create a platform for policy discussions if you invite, members of the municipal government. It creates new opportunities for partnership. And again, if you look at what you're doing and who's out there, sometimes you can identify gaps where needs are not being met. Or you could use the hub to report back and address the critical issues and who's doing what. And again, that also will lead to gap identification. So now I'm going to walk you through just one example of a hub. And so this one we designed, it is hypothetical, it is not occurring, but I did speak with World, or Women Organized to Respond to Life-Threatening Disease. And if they were going to put on a hub, this is what they would be interested in putting on. So they chose to focus on women, because of course that's their target audience. They chose September 7th. They wanted it after the International AIDS Conference because they were hoping to attend or have a representative attend the actual conference. And they wanted it to be close enough to use the momentum generated from the conference, but far enough away that some of the action items that came out of the conference could already have begun developing a plan of action. There's a list of some of the people that they would be interested in partnering with, and then they chose their title as Community Solutions. So their objective is to examine the impacts of the epidemic on women and then talk about community solutions and how they're targeting that epidemic. So their format, they would choose to do a whole day to this. You can do half day, you can do a week. You could do a series of one day per month for 3 months. Again, it's really what you have the human resources, the time, and the commitment to do. But the sessions will be there and available for you all the way through the end of the year. In this particular example, they chose to show 3 sessions, and then they're going to have lunch, and then they're going to have a skills-building workshop put on by an expert that they've invited from that area. And so they're having 3 breaks and 12 different speakers and moderators. And then in the venue, they chose to pair with Laney College or California Endowment. Both of those places would have space that they would lend. So, again, they're keeping their costs down. And then there's a list of local and regional stakeholders that they would invite. And they come from all over. In the next example, the Black AIDS Institute would put on they're a community-based organization, and they would put on a hub for they would put on a hub for community-based organizations that work specifically with young Black MSM. They wanted to target youth as well as Black men who have sex with men. They chose July 26th, and because they are national, they are going to use 3 different locations, one in New York, one in LA, and one in Texas. And they're going to do 3 hubs and then connect them virtually. So they have the internet capability and the computers to connect virtually and do the same. They're all participating in the same program, but they're all contributing different things to it. Some of their partners are listed there for you to see. And then on the next slide, their objective, of course, is to showcase the needs of young Black MSM and then to educate the implementing partners in the community on strategies for reaching out to them, to that target audience, and then to discuss regional advocacy plans. So they chose to do it in one day as well. They're going to do it in 3 different locations, again, across the U.S., and they're going to show 3 conference sessions. So they've chosen, let's say, a plenary, a special session, and a bridging session. So they are going to have 3 speakers across the 3 locations. So at, let's say, in LA, they will have a speaker that presents, and then they will listen virtually online to the speakers in the other 2 locations. And then they have 3 moderators that are going to coordinate that. And to keep costs down, they chose to do a brown bag lunch. And they would choose either the Harvey Milk School in New York, the Charles Drew University in LA, and Texas A&M for their 3 locations. And you can see some of the regional stakeholders that they would be pairing with for this. And so that concludes the end of the examples. If you have any questions, feel free to email me. I'm around all the time. It's megan.warren@AIDS2012.org. Applications, however, should be sent to hubs@AIDS2012.org. Currently, the paper applications are available online. You can just click on that and fill out, it's a Word document, and then you just email it to hubs@AIDS2012.org. Or you can wait and do the application online. Online applications open March 14th. So just keep that date in mind. And we will take applications after the conference as well. So if you're not 100% certain that you want to put on a hub, and then you're able to attend the International AIDS Conference and you just get excited and you feel motivated, you can submit an application after the International AIDS Conference. And I will hand it back over to Francisco.
Great, thank you. And so, Megan, as I prepare for the next slide, there's a couple questions that came through the chat. I don't know if you had a chance to review that while you were presenting. In the meantime, as you review those and hopefully answer those, I want to open it up for folks on the line to open up their lines. *7 to unmute yourself if you have a question for Megan.
Well, while people are unmuting themselves, I can go ahead and answer the question. The list for 2012, I can send that by email if you like. It might be easier just for you to go online if you go to www.AIDS2012.org, and then you click on the left-hand side, there's a link to Conference Hubs. When you get on the Conference Hubs page, there's a big picture on the right-hand side of a spreadsheet, and if you click on that, it will bring it right up for you. But again, if you'd like me to email it to you, I'd be glad to. If you'll just send me an email requesting that to megan.warren@AIDS2012.org, I'll send it to you.
And I just put her email up again on the screen.
And then for the next question about how long after the International AIDS Conference can you apply for a hub, the sessions will be available until December 31st. We will take applications through the fall. We prefer to get them earlier rather than later, partly because we can help you promote the event, but also because our office gets quite a bit smaller after the conference. So that would be great if you can send them as soon as you know. And you don't have to, as long as you provide us a basic outline of what you want to do, then we can go ahead and do a pre-approval. You don't have to have your whole program mapped out per se.
Great. Again, I think we have another question through the chat line, but again, does anyone have a question verbally before we get to the chat line question? *7 to unmute yourself. All right, Megan, do you want to answer the other question?
Sure. So the question is, if I decide to host a hub, will I have the opportunity to see or screen the presentations before so I can decide which ones to choose or which ones are more relevant for the region, and also the format that we'll be using? You can. The list of sessions will be available to view, the titles and stuff, in mid-June. So you could wait till then. You will not actually be able to download and screen the sessions until you're approved, until you submit an application. However, if you submit an application and you tell me, I'm interested in stigma, and this is what we want to do our topic on, and I'm not really sure yet how or where, what sessions we're going to use, we can still grant you pre-approval and then give you access to download the sessions, and you can watch them and pick which ones you'd be interested in showing, and then let us know. So, for example, if you turn your application in June after you see the list of sessions and you give me a basic overview, you can download them starting July 23rd when the conference opens. And then if your hub is in, November, we have plenty of time for you to watch them and decide which ones in particular you'd like to use. The sessions do come with a description.
And just to add to that, Megan, I think you mentioned this before, maybe, the recordings could range from an hour and a half to more, and you don't necessarily need to screen the entire session, right? You could just screen 15 minutes of it if that's all you really want.
Correct.
So there's some flexibility in terms of what to use. Are there any other questions? *7 to unmute yourself.
Hi, I've got a question.
Great.
Hi, this is Lisa Marshall with Results, and I don't think I asked my question very clearly on the chat, so I wanted to try again. Wondering, the AIDS conference schedule isn't up yet, and I know that it's marked to begin the 22nd, but don't really know if that's a soft start, maybe with the Global Village only, and the plenaries and the things that we can use for the conference hub will be available later, or maybe everything does begin on the 22nd. Could you speak to the scheduling a little bit?
Well, the list of what's been selected, so for example, the abstracts will be selected in May and speakers will be invited and they will accept, and we'll put together the actual program and you will be able to view that in mid-June. As for actually downloading and watching the sessions or having access to see, what goes on in that session, it's not actually available until we film it. So, for example, if an abstract is approved in mid-June, you'll see the title and the description of the session, but you won't actually be able to view the session until we film it when it occurs in the conference. So if it occurs at 9 a.m. on the 26th, you will not be able to see that session until 6 hours after 9 a.m. So
right. Yeah.
If you want to do a hub during the conference, I kind of recommend that you do it toward the end of the conference because you will have access to a lot more sessions. So if you do a hub, for example, on the 25th, you will not have any access to sessions that occur and are being filmed on the 26th and 27th of the conference.
Right. Okay. But it's possible that there might be sessions that were recorded on the 22nd that would be available on the 23rd?
Correct. But actually
right.
On the 22nd, there are not, I don't believe there are any sessions per se.
Okay. Okay,
the actual abstract sessions start on the 23rd.
Thank you.
Uh-huh.
Any other questions? Start on *7 to unmute yourself. All right. Feel free. I'm going to go through a few more pieces here for this webinar. If you have any other questions, feel free while I'm doing this piece. Please, type in your question via the chat, and then I'll open it up again one more time for questions, and then we'll wrap up. So just quickly, wanted to speak to you a little bit about the Community Abstract Mentoring Program, also known as CAMP. And so for many of you who have joined us for previous webinars, probably could be doing this presentation for me, but basically CAMP is an online abstract mentoring program with the focus of strengthening abstract submissions from communities of color. And so there are CAMP mentors. There's about 32 individuals who have been trained by IAS, so again, the main conveners of the conference, to be CAMP mentors. And so they received the 2-day training, and they are providing their service for free via this online portal. So what you need to do is simply register to the website, which is listed on the slide. It's abstractsassistance.org. There's no charge to submit. And just one exciting piece is that we actually extended it. Originally, this program was closing February 1st. given the fact that folks were still interested in submitting more during this time, and understanding that we're all busy and, developing abstracts usually is not the first thing on our minds. We extended the deadline for CAMP to receive feedback. So as a reference, the deadline for the actual AIDS 2012 is February 15th. So while we extended it for February 12th, we're hoping that folks use the service prior to February 12th to get feedback from their CAMP mentors. I just wanted to also show you just a snapshot of what the screen looks like. Very similar to the International AIDS Conference. It's the same pieces of components to the abstract that you would have to complete for an abstract. So there's a background, method, results, and conclusion piece. You could provide your draft text, which is loaded right underneath the orange colored, which is the text of the abstracts. And then you could also provide a comment for the mentor who's reviewing your abstracts that, look at sentence 2. I'm not sure this is a great way to frame it. And then they will provide their response underneath that in the text that's provided with the arrows are showing. And so there's that component to get actual really good mentoring from lead experts in the field who've been trained on all elements of your abstract. Using this system is not an official submission to the conference. I just want to emphasize that this is a complimentary service that was developed with support of the Office of AIDS Research at NIH to support, again, the submissions of communities of color and those who serve that community. And so, there's a great opportunity for folks to use this program. And so just letting you know that it was extended to February 12th. Again, the website is abstractassistance.org. So I want to open it up again one last time for questions for Megan or myself regarding CAMP. I think we have a question on the chat. Are the subjects that are in the hub more elaborated and specific, and can we use the ones that were used in 2010 now? Megan, did you get that?
Yeah, the subjects in the hub, I'm not quite sure what you mean by that, but if you look at the spreadsheet that's online, you can sort by either session type or theme. So, for example, if you sorted by gender, you can see there's a symposium on gender matters in care and treatment. It will give you an idea, if you want to sort by affected population MSM, of what is available, what types of sessions are typically shown. Again, the sessions from 2010 will not be available. They were shown before, but they will tell you the types of, the focus and the types of themes that you will find in the 2012 conference.
Great. Any other questions for Megan? All right, and just to wrap up, I wanted to share with you our next webinar. We'll be focusing on developing a great PowerPoint. We'll be focusing on different things folks should consider in developing their PowerPoint. While this focus is for, obviously, the International AIDS Conference, this webinar would be useful and transferable to other conferences and presentations that folks are developing. And so I urge everyone to register. All the remaining webinars are listed on this as well as their dates. The screen that's on the website that's on the bottom of the screen, abstractassistance.org/home/webinars, has all the registration links for all these webinars. So I would urge folks who, if you're interested, to register ahead of time and just have it ready, and so you'll get the reminders for these webinars. In addition, all the recordings of previous webinars are also available on that same website, so you'll be able to not only view past recordings, but also register for upcoming webinars. And so just one more check. Any more questions for Megan before we end the day? All right. Thank you again, Megan, and everyone who joined us. Feel free to join us at facebook.com NLAAN, as well as please complete the webinar evaluation. Thank you.
Thank you. Please stay.